Hello and welcome to Rewire Your Brain. This is our four-part series. And in session one, which is today, we're doing Discovering Neuroplasticity. Hey, I'll be your host today. I'm Izzy Nally, and I have with me Sherry Odom as well. And we are the Neuroplasticity Alliance. And our goal is to bring this education to you so that you really are charting that path to recovery and resilience. So in this four-part series, each session is going to be recorded. Replays will be available in the course portal, and so you'll need to register for that separately in order to access the replays and any resources. Throughout the sessions, we'll ask that you put your questions in the chat, and we will address those at Q&A moments. There will be, if you are live on Zoom, the pre and post survey poll as well. All right, so 1 in 2 people, that's 45 to 50% of the population, especially in the US, will experience a neurological challenge within their lifetime, which also means that nearly every family will be impacted by this at some point. This is a huge problem that we really do need to bring attention to. And as we'll continue to talk about within this series, the need for education, not just for the individual for that empowered and advocating path, but also to help bring this up to light so that more and more of our doctors, physical therapists, anything along that path are receiving the up-to-date information. And we'll discuss too, like why that might not always be present within the systems. As we look at neurological challenges, we'll see here, these are 4 buckets, categories. This is by all means not all of them, but some of the top ones that we are seeing. That'd be stroke, TBI or a brain injury, spinal persistent pain. We also have things like anxiety, depression, trauma that are impacting the brain. And then we look at developmental and then also diseases. This is one of the big reasons why the Neuroplasticity Alliance exists. Our mission is to connect individuals with neurological challenges, and of course their families and caregivers as well, with the resources to accelerate this recovery. So our vision is a world of neuroplasticity-based therapies being standard of care. And so we're doing that by educating, which is why you're here, and also empowering individuals, also to support the providers and innovators as well. So as we get started, let's start with a meditation activity. So we'll just find ourselves in our seat. You might close your eyes. Of course, if you are driving or doing anything, make sure that you don't close your eyes. But as we're here, we'll just start with some big belly breaths. So allowing that belly to get really big as we inhale, and then allowing it to deflate on that exhale. And as we take these big belly breaths, this also is helping to tone the vagus nerve, which is what's going to help us get out of survival or that fight and flight and into rest and digest. So those big, deep belly breaths. As we continue to feel into those, if your eyes are closed, you might begin to tune into the sensations of your body, starting at the top of your head, working down the spine, continuing those deep breaths. So you feel your bottom in the chair. You might feel your thighs in the chair, your feet on the floor. And even if you don't feel those sensations, imagining those sensations, imagining the feeling. And really research shows that just practicing, we continue to rewire the attention. Now imagine out in front of you this movie screen. And on this movie screen, I invite you to see yourself at your happiest, at your healthiest. We don't need to know the how in this moment for this exercise. But imagine that you have recovered. What would you be doing? What would you be experiencing? How would you be feeling? Now, seeing the people around you and how that impacts them. Maybe it's people you know, maybe it's people you don't know yet. See the impact of that. And there's science behind the belief that it's possible. So I invite you just for this moment, maybe if you don't, to just for this moment, believe that that is completely possible. And then take another big deep breath. And then begin to flutter your eyes open. So we're going to start with a case study and really seeing here what is possible. Phil had developed multiple sclerosis, and in that he loved music. He had seen his father use music with cerebral palsy to help heal himself as well, and in this progress to recovery. And Phil ended up creating his own plan. He created a self-designed recovery plan that was 10 months. And in this, he went from barely being able to play, as we'll talk about here in a moment, to now he is playing better than he ever did before. And so he broke this down into steps and into phases. But the important thing to mention here is this isn't one time a day. He was practicing 3 to 4, sometimes 7 to 8 times a day throughout this process. Where he began, so he began with just feeling his fingers in the position for touching those chords. So that neural map. Then he began the physical build. So he focused on the finger strength. And then he began to resynchronize both hands to do those individual notes in a smoother way. So this was a progress. Didn't happen overnight, but within 10 months, again, he is now going out and playing and showing others how he did this journey as well. Sherry, was there anything that you'd like to add about Phil since you have talked to him before?
Yeah, I think you hit on it. What the main takeaway I get from this specific case study is that he completely lost his ability to play through his diagnoses of multiple sclerosis. But through that process that Izzy just talked about, he was a better musician uh, after relearning to play because he put very clear intent and focus on each of those individual moves, how he used his fingers, where to place them, what the strength or the pressure was on each one of those, and then really focusing on the synchronization of which hand goes where and how do they work together to create that melody and the flow so that it was smooth. And he credits his not and I should also mention here, not just one instrument. Bill plays about 7 different instruments, and he had to reteach himself all of those instruments, guitar being the most difficult. And I do encourage you to go to Instagram. Down at the bottom of the slide, you can go to Get Back Your Music, search that on Instagram. He's got a very active Instagram page where he shares these lessons. And there's quite a few, I guess, interviews really of him on YouTube. He's been featured on the Multiple Sclerosis Society page. He's been interviewed by both local and national news. So he's got quite a great story. And the other thing is it was all self-motivated. They told him he would not recover his music, and he said no. I saw my dad learn to open and use his hands through the use of music, and I know that I can do it. And he just, as it says here, I just simply did not give up. And if you talk to him, that's kind of his message to everyone. Don't give up. One step at a time. It's incremental. So I like to include this case study because I think it's very powerful one because it's truly his internal motivation. It's the salience of neuroplasticity. It meant a lot to him, and that was a driver internally. And he by breaking it down into incremental steps that were just enough push, not enough to get frustrated, but enough to really create a little bit of friction there. He had to work hard to do it. You can see that it's possible. You can also see that feels not necessarily under 30 here. And and it does show you also with neuroplasticity that it takes a lot more practice. He was practicing some days 7 to 8 times, even more actually. If you talk to him, you'll hear him say that. So it does take work, but he's proof positive that you can do it, and not only do it for yourself, but become a mentor for others.
I
So
love that.
yeah, thank you, Izzy. He's truly an inspiration, and I really do encourage people to go check him out for yourself.
Yeah, and I would say too, even if you never played an instrument, this is something that's definitely possible. It's all about wiring new pathways, right? Creating new pathways, rewiring them, rerouting them. And so even if you didn't play music before, this could be a great therapeutic modality for you. And to also recognize this ability for hope and this ability to, in his mindset, to see that his dad did it. Therefore, it pushed him, it laid a foundation for him to know not to give up. And that's part of the reason we want to bring these very real case studies here is to show you what is possible. Because when you have that mindset of what is possible, I know it's possible, it allows you to pursue things a little bit differently. And just as we did the meditation, there's real science behind visualizing, feeling into it, and the emotions that you can muster up inside of you just through a meditation. That in order to rewire, there's also a emotional quality, a mindset quality that goes along with it. And we'll continue to talk about that throughout today's presentation.
Yeah, I think that's a good point, Izzy. Those emotions create neurochemical signals in your brain. So any type of emotion creates an electric and neurochemical signal in your brain, and that is what helps cement those activities together.
Mm. Yep. So when we add the emotion, and we'll get into a few of these, like the novelty, right? I think we all remember as a kid having that first time experience, and if you close your eyes, you might be able to even re-experience it all over again. You're remembering the smells and the taste and the sensations and the noises, and that's because it was the first time and you were fully present. So doing things for the first time can also be a great way to do that with new activities. And so in this series, we're going to dive in. Our goal here is to give you more of an overview and then continue to dive in deeper so that this is easy to digest. We'll talk about what neuroplasticity is, the principles of applying neuroplasticity, and then, of course, self-advocacy and interventions. So neuroplasticity is the brain's ability to rewire and heal at any age. And this is so important because studies have been done where traditional based therapies alone get about 30% results versus when we add in neuroplasticity based therapies to those traditional based, it doubles and gets 60% of results. So, or 60% improved. So this is really amazing. I mean, it's doubling the outcome. And so it's important for us to learn what's available, learn what's working. And we'll say too, it's normally adding a multitude of different therapies in. We're here to make sure that's empowering you so that you can make those informed decisions, building that confidence so that you can collaborate with your care team. And then we want to give you that expert guidance, that the hands-on learning too. So we're going to do that a little bit throughout the series and show you some paths. No matter where you're starting, neuroplasticity is still available.
Yeah, and I would just like to add to that, Izzy, is the chart that you're showing here is neuroplasticity integrated. So what that really means, if you think about it, we're taking a lot of those traditional therapies and adding a neuroplastic component to it. And that accelerates the effectiveness of that original intervention, regardless, it seems almost regardless of what it is. And as we progress into learning how to apply these, as we'll talk about here in just a minute, we really are on the cusp of learning how to apply neuroplasticity effectively. But just the simple act of knowing that it exists and believing that and changing that mindset. And like Izzy was talking about, that visualization makes a huge impact on its overall efficacy, and which is how you get this doubling. And even in many cases, we were being conservative here with this chart. There are cases where there's 70, 80% and even complete recovery.
Mhm.
And this isn't about creating false hope, right? This is about sharing with you the potential for what these interventions can bring, but it's all very personalized. And you can't really get hung up on how much more effective something is going to be with neuroplasticity based therapies, because it is so personal, and it is it depends on what you put into it too also.
Yeah. And not sugarcoating it, right? As we were talking about that case study with Phil, I mean, he was practicing 7, 8 times a day. That's not an easy feat for someone to take on. It takes a lot of dedication, but that makes it a whole lot easier when you know what the result could be. All right, so doing our due diligence, we must have our disclaimer to say, please discuss this and anything that we're talking about within these presentations with your care team. That is ultimately our goal, is so that you can partner with your care team. And in this route to self-advocacy, right, knowing what's available. So please discuss these with your care team. All right, so let's dive into neuroplasticity. Well, first, we need to say that longevity is definitely a component of neuroplasticity. And sometimes we've seen more and more it's getting popular, these longevity cases and therapies and things along that nature. And it's not just about living longer, right? There's about on average about 10 years of poor health towards the end of our lifespan. And what we're really hoping to help encourage people with and in promoting neuroplasticity is that we can shorten those years or maybe even make you just full of life until the very end. So it's not just about living longer, but it's also about that quality of life too. Now,
Yeah, I was going to say, just to add to that, Izzy, Dr. Dale Bredesen, there's so much work now that says the lifespan for humans, they believe that it's 120 years. Like that's the maximum that you're going to get at this point in time.
mhm.
And we are slowly approaching that. If you look at all of the research and everything that is being done now to extend the lifespan, that is not really unheard of, especially if you look in Japan, where it's very normal to live to be over 100. And here in the United States, females are on average living to 80 and above. So if you're going to live longer, you want to make sure that you live healthier through those years. And while neuroplasticity and a majority of what we talk about is recovery, a big piece of that message is about how to ensure that you're healthy throughout the full span of your life. And how do you do that? Neuroplasticity is really one of the key factors. And everything you do for that longevity improves your brain health as well. So those two are very closely aligned and tied to one another.
Yeah, and some of these, I believe it's blue zones, right, where people are living extremely long lives. They're doing research and showing that these people are very capable, very cognitively aware, uh, up until their very end days, which is absolutely amazing. And we don't typically see a lot of that here in the US, particularly. So I think it's important to talk about that, and wanting to enjoy every inch of life that you get, right?
Yeah.
And within research studies over and over, it's showing that most patients' biggest fear is not death. It's that loss of independence and cognitive decline, not being able to enjoy the life that you have. And when we add neuroplasticity in, it's showing remarkable results. So stroke patients who received neuroplasticity-based rehab had 2 times greater function recovery than standard care alone. And then people with strong social connections, which in our book club, we are doing Why the Brain Needs Friends. And it talks about like social connection and purpose and having physical activity. So it's not just one thing, it's multiple things included. allows you to live 7 to 10 years longer and report far higher quality of life as well.
Yeah, I'm so glad you put these research studies up, Izzy, because they're sort of a lot of what backs up that first chart that we went into, right? So in some cases, and the therapies do vary, and I think that's an important piece of this. You've got, the 2x on some of these interventions for stroke, and then 30% for people with MS, based on those interventions and dementia. Slowing that cognitive decline by 40%. So the thing is how to figure out what's right for you for what your specific situation is. And these studies also are early stage studies, right?
Mm.
What this is showing, these are not showing some of the more recent work that is really 80% and above, and even full recovery. So, and that research every day is changing and showing us what the progress is, and showing us how the integration of maybe one therapy that was used for stroke could also be used and combined with something else for, let's say, something like what Phil did for multiple sclerosis. What he did for multiple sclerosis is easily applied to a patient with stroke.
Mhm.
So it's understanding how the neurological system works better and how these interventions work specifically, and pairing those together, which is how I think over the next 2 years, when we show this slide, I am
Mhm.
almost certain that you're going to see a
Yeah.
big jump in the effectiveness of that.
Well, and this is an important time for us to mention too that it typically takes 17, even 20 years for research to make it to the public, right? Like for us
Good
to even
point.
have these statistics. So some of these statistics might be anywhere from 15 to 20 years old. And more research is being done. And neuroplasticity research alone has had a substantial boom, and more people are not even doing it at the clinical level. There's so many doctors, physicians, healthcare providers that, like within the summit, right, that are doing so much of this research on their own and then working to push and get it out there. So, you know, Sherry works very diligently to go find all of this new information and get it to you and the public as fast as possible so that we can help shorten that gap. So, how did we figure out neuroplasticity? Not us personally, but as a society, right? So one, there was this growing need. People were getting very frustrated, and I'm sure you have probably experienced this at some point when someone tells you there's no cure or this is just what you have to deal with, and people not wanting their loved ones or themselves to have to stay in that state. So one fun thing that happened was this neuroimaging, which that also helped revolutionize this as well. But there's one where they did neuroimaging on meditating monks and showed how it changed the shape of their brain. And so it was showing us and it was giving us this glimpse that there's more activities than they knew at the time that could actually reshape the brain. Um, Wearable technology has also helped in pushing that. More and more research being done on how these small things, which we'll show later on, it looks like very simple things that are changing the brain. And so more and more research has gone into helping understand that. And then, as we mentioned, a lot of these physicians, healthcare practitioners are testing things out on their clients and seeing what's working. And then they
Yeah,
keep repeating.
that slide is I think a really great slide, because it shows that, and what we didn't show in our earlier slide or talk about really was, even though 1 in 2 people now are going to be affected with a neurological challenge, that has increased, yes, over 60%, even from the 60s. So that the demand has skyrocketed like this. And then at the same time, we've been developing technologies that have given us the insight that the brain is shapeable, it is plastic, and we can see how certain activities modulate those neurons in your brain, the brain cells, and how it changes it. So that has opened up this entire new window for anyone who's involved in neurology and neuroscience to say, look, there is this huge need. We now know that it can be shaped and changed. The question
Mhm.
is how and in what way. And that's kind of where we're at now. And I think you've got a great timeline here on this slide on the right hand side, Izzy, if you want to walk them through that.
Yeah, we really, so overall, we've moved from very much this theoretical into clinical application. So right now we're in this course of the timeline on history where people are taking all of this theoretics and they're really applying them and putting it into clinical application. But where this started in the 60s. And people continued to create the theories behind it, test it out. And it wasn't just till 2000 that there was the Nobel Prize on the finding of this. But most people that you'll talk to, they really refer back to Norman Doidge's books, which that didn't start until 2015. And so we have all these clinical practitioners that they're really reading these books and referring back to him. And if we really look at that, that's what 11 years ago. And if we have just people now doing clinicals, then it's just not getting out into the education system. So doctors, if they didn't learn this in school, then they have to take it upon themselves or their employer to provide that education. And so there's a lot of steps that have to happen in order for the doctors to get this information into their hands.
Yeah, there's Michael Merzenich, who I think it was 2007 wrote Live Wired. And that book really, it brought it into the mainstream for research and said, okay, neuroplasty is here. This is what you can do with it, sort of building on the work that Eric Kandel did. And then Norman Doidge really brought that into oh no, Softwired. I'm sorry, his book was called Softwired, not Live Wired. And but Norman really brought it into the mainstream. So he then sort of brought the demand side of the supply side together so that the physicians out there and the innovators started thinking, okay, we can apply this. There's a demand for it. It's not just a research theory anymore. There is a practical application. And here's the possibility. That's what Norman Doidge's book really did. He laid out all of these case studies and examples and said, this is really the potential that this has, which really spurred the demand for that.
Mhm.
And out of his work, really, you get the fact that the neuroplasticity is the brain's ability to rewire. It can do it at any age. It doesn't matter what age you are, and it's in not in just humans, it's in all mammals. I would venture to say more than just mammals. I think a lot of Merzenich's work were using some sort of worm, I believe. So
Hmm.
it's how we learn, and if you think about it in those terms, any way that anything learns, that is rewiring the neural system.
Yep. Yep. And it's super fascinating. If you want to learn more and read these books with us, we do have the Brain Builders Book Club. And in that, like one of the first books we started with was The Brain's Way of Healing. And we recommend even just going to the book club website and you'll see all these lists of books as well, just to start your self-education journey in that way as well. So neuroplasticity, starting to dig into really truly what that is what Sherry was saying. It's the brain's ability to rewire itself through experience. And so the experience might be, as which we'll get into later, it might be a device that can help, but often it's a physical activity. It's an exercise of sorts. And that exercise might be a mental exercise. It might be a physical exercise, but it really is these repetitive things that we are doing. And we use the word rewire because it is as if you are creating this groove, creating this path. One example that we love is like a forest. You go into the forest and there's no paths. To create that path, it's going to take some effort. You're going to have to walk down that path several times before the path is there. And then other people are walking down it right in the forest and it becomes fairly permanent. Now, if a storm was to come about and place a tree in that path, you're then going to take another path around. And the brain can reroute in those ways too if one section of the brain is no longer useful. So it can reroute in that sense. And this is lifelong. This is regardless of age. Now, that being said, after 25, it does require a little bit more focus, a little bit more challenge, but your brain's continuing to generate new brain cells throughout life.
And the thing is, when you talk about experience, Izzy, it's any sensory input, right? So it's what you hear, it's what you smell, it's what you taste, it's what you touch, feel, movement. Any sensory input creates that neuroplastic response. So when you think about what you're doing right now, make sure that it's intentional because you're changing your brain in some way, shape, or form.
Yeah, and we'll talk about that a little later on today, like how there's a positive way and a negative way that your brain's not going, oh, I'm only going to take the positive things or I'm only going to take the negative things. Like it's just whatever you continue to repeat. And so how this has changed recovery is the old way of thinking about this and the old way of recovery that many doctors are still practicing because this is what they learned in school is that deficiencies were viewed as fix. So they would focus on a workaround, right? Examples of canes, memory aids, just getting used to living that way. And the goal was more focused on adapting than it was recovery. But now with neuroplasticity, it's shift because we're trying to understand the damage. We're targeting the impaired functions to rebuild them or reroute them. And often this is requiring multiple modalities. So it's not like there's one thing that's going to fix it. There's multiple modalities, which we're going to go through many of them throughout this series. And the goal of it is greater independence and quality of life rather than just adapting. As we already mentioned, 17 to 20 years for cutting edge research to reach mainstream clinical practice. And it really is advancing at just an amazing rate. Sherry and I would joke, we're like 6 months to be gracious, but really like there's so many changes that happen every single month that are just coming out from multiple different sources. And we have to keep in mind too that these traditional therapies really were influenced by pharmaceutical based models, whereas a lot of neuroplasticity, again, that we're going to teach in this series, really is everyday things that you can put into place. Things that we're teaching you to say, hey, these are things that you can implement where you can take charge of your recovery journey. And so a lot of things that we're going to be teaching fall outside of the pharmaceutical domain. And it really falls a little bit more into that physical therapy aspect or OT than it would in more of the traditional, let me prescribe you something.
But and we say that, and there is a role for pharmaceuticals. It's not that we are anti-pharmaceutical at all, because and we'll talk a little bit about what the role for pharmaceuticals are in this approach going forward. But the purpose of neuroplasticity is to try and address the root cause versus masking symptoms, which is much of what the pharmaceutical approach has been symptom based, right? So let's treat the symptoms versus the root cause. And therein
Mhm.
lies the real big shift. It's root cause versus symptom based approaches.
Yes. Oh, it reminded me of such a great example of just masking symptoms. I read in this book one time, she was like, if there's a smell in your house and you keep putting all the air fresheners in just to try to make life comfortable, she was like, but if there's a dead animal under the house, you should probably just go remove it. And so really figuring out like what is that root cause and then working with that.
Yeah.
Just a little humor, right? All right. Sherry, would you like to take this one?
Sure, yes. I think it's very important to think about applying neuroplasticity as a process. It's not, back to the pharmaceutical example we were talking about, it's not taking a pill, if you will, and you're sort of done, right? With neuroplasticity, it is a process that you have to work through and follow with consistency. So the first step really is to put your brain into a state of plasticity. Why does that matter? Because the more plastic your brain is, the more adaptable, more flexible it is, the easier it is for you to learn something. This is why, as a child, they learn by osmosis so quickly. They don't really have to work at it because their brain is growing and it's changing and it's very plastic. As you grow and age, that becomes less so, which is why it takes more effort to learn something. So, in doing what you can to ensure your brain is in a state of plasticity so that you can learn faster is step one. And that involves things like your mindset, exercise, sleep, nutrition, those lifestyle factors primarily. Then the second step is learning. So if you're trying to modify and recover, you've got to rewire, right? So this is the learning, taking those sensory components and exercising them and modifying them in some way, shape, or form. To do that, it requires focus. So that's intent. You have to pay attention and be in it and present with what you're doing, which is why we put that meditation at the beginning. Is these really great meditation. It helped us focus and be present with what we're learning today. So that focus, it's got to be a little difficult. There's got to be a little bit of friction. So in Phil C's example, it can't be too hard that it gets frustrating, right? But it's got to be enough so that it's pushing you so that you're causing those neurons to rewire. You have to repeat it, right? That you've got to do this over and over again. Back to Phil C, he was doing it 7, 10, sometimes 12 and 15 times a day. He would work on it. And that is the case. The older you get or the less plastic your brain is, the more that repetition and friction and focus becomes a factor in accomplishing the goal. And the next piece of that is the reflection. So you're like, okay, I did this, this, and this. How did that work? Do I need to modify it? Do I what do I think about how my hands were? So it's that reflection piece of what you were doing, which helps to cement what you've learned into place. And then the third part is sleep, and that is really from a long-term memory standpoint, that's where all that gets consolidated. So if your sleep is interrupted, if it's not continuous, if you're not going into deep REM sleep, you don't have an opportunity then to cement those learnings into place so that it's becomes automatic, right? So if you've lost some sort of capability that once was automatic, and in Phil's case, playing the guitar or playing the drums or one of his other 6 instruments, he didn't have to think about it, right? But he had to consolidate that again, and sleep is such a huge piece of that. So that's the process. In the middle of this diagram is all of these influencers, and we're going to go into detail into those in I think weeks 2 and 3. So stay tuned if you're to get a little more deeper.
All right. So next up, and Sherry, let me know if you can see this.
Yes, if you want to make
What
it
you're
maybe a little.
looking at here are two neurons under the microscope that I've filmed. And if you wait really patiently, you'll be able to see them connecting to one another.
So here you'll see the little dendrites, the tentacles are connecting, and as they connect, there is the connection where we start to form new connections.
What you're looking at here are two neurons under the microscope.
Yeah, so if you think about that as neuroplasticity in action, that is what's happening inside your brain. And anytime you've got some sort of sensory interaction, those neurons are finding themselves towards one another to build that pathway so that those messages can move across smoothly, quickly, and efficiently. And the more you use or do that exercise, whatever sensory input you're using or leveraging, there are other neurons that come and join that, and you get a really super fast highway. And if you want to use that analogy, or the path through the forest becomes deep and rutted and wide. And that's how it forms. That's how you create that. So when something comes and it's automatic for you, you don't even have to think about it. You can visualize in your brain a really, yeah, Izzy, really strong connections between more than two neurons, a bunch of neurons.
Yeah, it's kind of like a cord or a rope, like imagining all those different strands to make it even stronger, right?
Yeah,
Um,
perfect
and, and more,
analogy.
and we're going to talk about in session two. So next session, we'll go over all the different influences, because you can see here, like it's not just these items connecting. There's fluid around it as well. So there's different influences. We'll go into that deeper. But really working on this path to recovery, we've created a pyramid to help understand, kind of a hierarchy or a process within this. But neuroplastic knowledge is extremely important, because if we're trying to create a neuroplastic lifestyle, if we don't have the proper knowledge to help influence that, then the second pillar is not quite as strong. So having that knowledge as the foundation, and the same thing goes with self-advocacy. If you don't have the knowledge, if you haven't made an attempt at the lifestyle, and it's going to make it a little bit more challenging to really advocate for yourself. And intentionally, we put interventions at the top, because this is really the components that we need to make sure that we are advocating for the right inventions or interventions, and that we are making sure that they're going to be really truly the best ones for us, and knowing what's available.
Yeah, and I think the size of these really do represent the amount of effort. If because doctors who I mean, even the last 5 years, right? If they graduated in the last 5 years, they probably were not educated on anything regarding neuroplasticity. They may have been told that it exists, but they didn't do a deep dive and understand how to apply it and what to do. In the last 5 years, I would say even maybe just the last 2 to 3, quite frankly, they're now starting to be educated on that, and it's becoming part of that curriculum. So you, as the person who's seeking a recovery using these new interventions and this new discovery and breakthrough in neuroscience, you have to be the one who is helping to bring this message to your care team. So that requires you to do the research, requires you to understand how to integrate these things into your lifestyle, so that you can advocate with your physician well, and then you can get to that intervention. Now, the intervention requires work, as we talked about with Phil C. He was working hard, very hard, to put that into place. But that's sort of just like the tip of the iceberg, if you will.
Yeah.
All of the work, what's below that tip of the iceberg, is so much bigger and so much more, a greater component of that path to recovery. Um, and that will decrease over time, right? But that's where we are right now. So if you want to try to leverage it, you have to just understand what your path to that process would be.
Yeah, and speaking of work, we talked about nurturing your recovery.
Just in time
Uh,
for spring.
yeah, yeah. And really, right, like we need this good soil to plant the seed of any treatments or therapies or anything to go in. And that soil is really the lifestyle. You creating the environment for success of these treatments as well. But Sherry, I'll let you go into to the example of here.
Yeah, I mean, the goal with this slide is, and the one before, really is to try to help you, give you some analogies you can use to help you understand what this is about and how to think about it. And certain analogies work well for different people. So when I was thinking about how to explain neuroplasticity and how you should approach it, how you, as somebody who's seeking recovery, should approach it, the farmer metaphor really, and the gardening metaphor really just stood out to me, because you were the farmer, right? You're the one who's going to plant it. You're going to tend the soil. You're going to pull the weeds. You're going to plant the seeds. You're going to choose and maintain your tools. And then you're going to harvest it and gather the rewards for that. So you are the one who is guiding this full pathway, and you've got the vision for where you want to go. You know best, better than anybody else, what your situation is and your lived experience is and how that needs to be treated to get to the end goal, right? So you have to become your own advocate and you're the one who has to put in the work. But you have to have a plan. So you got to sit back and think, what are the symptoms that I really want to address here? What is that's causing me my lack of freedom most? And you do need to do some prioritization and you need to understand your symptoms very well. That means things like keeping a symptom journal. That means really getting some feedback from others on what they see is happening in your life. And then you've got to manage your body and your brain, creating that lifestyle that puts your brain into a plastic state, which is this enriching the soil. You got to get the right nutrients to do that. You've got to make it so that the soil is flexible and the seed can sprout and grow really well. You've got to figure out how much sunlight it needs, how much shade it needs for what plant you're going to put in there. And if you just don't have the right tool for the job, it's going to make it so much harder. So that's where your knowledge of understanding what interventions are out there and how do they work for the symptoms that I want to address first off.
Mhm.
And doing that all together will get you to the end goal. It may, and your output, what your harvest is going to be, is very personal, right? It really depends on your work, your care team's work, and how much emphasis and effort you put into the process. Now, there are speed bumps along the way. There are insects, there's floods, there's not enough water, things like that. And so you have to pivot at times and know that that's part of the process as well. It's not linear, it's not a straight journey.
Yeah, and that's why that mindset plays such a key, right?
Mm.
There's a lot of trust in like having some soil, putting a seed in it, and trusting that food's going to grow. Um, and and that might feel like that at times with things that you're experimenting. And sometimes we try a therapy, and if it didn't work so great, there's multiple components that we need to look at, as you just said. Like maybe it's the soil isn't healthy enough, maybe it wasn't getting enough sun. So looking at it and knowing that it's a multifaceted approach.
Yeah, I think that's a great way to sum it up, Izzy.
And then the foundation principles of neuroplasticity. One, it's neutral, as we mentioned early on. Your brain is just, and your nervous system is just wiring whatever you repeat, whether that's good, whether that's bad, whether it's recovery or compensation, like whatever you're doing, that's what it's going to latch on to and form those connections. So it really is neutral in the opportunity, but also in the responsibility of knowing what you are wiring. Repetition, right? Repetition, it requires repeated action so that that change can then become consistent. And wiring those pathways, right? Like even though it wired, we then want to strengthen it and continue and continue. So just because you did it for, right, a lot of people, they do it for a week or two, and then they're like, I'm not seeing any results. I don't know if I want to keep going. And we're saying it takes 3 months plus to be able to notice little shifts and changes. So knowing that there is continued practice. And part
Yeah,
of that is
and
going
that
to be,
can, oh, sorry, Izzy. Yeah, that can vary, right? Many
Mhm.
therapies, people see changes within a day. Quite frankly, that is not unheard of at all. Or a week, maybe. No, maybe not some people in a day, but in many cases, it is a week to 2 weeks. But there is a fair amount that if you get to that 3 month time frame and you're not seeing significant changes or any changes, then maybe this is not the right thing for you if you have been consistent in the application. And therein is a big piece of that repetition piece. And you've got to do it with the intent and intensity and focus that Izzy's going to talk to you about.
yeah, which it's really great to look at this too. Like if you are working on a new practice of some sort, to really look at these foundations and make sure that you're applying them, because that could also be one of the factors where it might be not making as much change or making it as fast. So intensity and focus is another one of those big components. The brain's going to change in proportion to how hard or how challenging, and how attentively you're engaging, right? If you are trying to listen to an audio book while you're doing dishes and someone's talking and all those things, you're not going to have as much focus. If you are listening to this presentation and you've got a window open, right? Like you're not going to be as attentive and retain the information as well. And then the same thing with intensity, right? If I wanted to make a path in the forest and I'm just very lightly doing it versus if I am intensely working at it, there's going to be a difference. And some of these things might seem common sense, but it's amazing when we start to apply and try to make change, that change is hard because it is forming a new path, and that requires a lot of effort. And it requires more effort, right?
It does require more effort, but as you were just sort of alluding to, Izzy, if you know what's happening and you know that that's what you're doing, it does help you get that extra few repetitions in, because you know you can visualize it of what's going to happen, and you can visualize the output on your end, and it does make that change a little bit easier, I believe.
Yeah. Yeah. And just as we did, as you mentioned, the visualizing it, like with the meditation that we did in the beginning, you're in your brain, your reticular activating system. If you are visualizing yourself in recovery and you practice even these mindset repetition, even with that, your reticular activating system is coming on board to going, well, that's possible. Let me search for and do the things that are going to help me
Mm.
make that happen. So even just within the visualization component, these principles are still applying. And challenge, right? So there needs to be a level of discomfort, because that means we're wiring something new. If it's easy, there's most likely already a pathway formed, which is why it's easy. And then salience, which is what matters, if it's meaningful, if it's relevant. And again, as we mentioned with the visualization, with the emotions, is it going to be a positive experience? Is it meaningful, so that you can have a little bit more attachment, uh, play on words, right? Like attachment to that happening.
Yeah, this is the emotion piece of it, right? So if it's relevant, it has some sort of meaning. That means there's some sort of emotion attached to it. And for Phil, that was playing the guitar. And this is where much of the personalization comes in to building your own program and plan. If you heard Gary Whitaker talk during the summit at all, you can see that exercise was something he loved to do. He did not realize that that was helping and promoting his neuroplasticity, and socialization. He was very social, and those two things meant a lot to him, and he worked hard to be able to continue to do that, which paid off. if you're
Mhm.
if you're developing a plan or program that has you doing something you do not like and you do not enjoy, just stop that, because it that negative emotion and plays a big role within the ability to learn and have those neurons connect effectively. And so the relevance for you is that emotional component, and you need to take that into account. If designing an activity or a program involves something you enjoy and that you are interested in learning, you will learn it a lot quicker and a lot faster, and your progress will be much smoother with that principle in mind.
Right. And I had this visualization of like kids, right? I have three, so this is relevant for me at least. And I think most of us can visualize, if you ask a child to do something like go clean the kitchen and they don't want to do it, that kitchen's probably not going to be very clean.
Mm-mm.
Versus if they're excited to do it and they see the value, maybe they also like to cook or bake or whatever, the kitchen's going to be a lot cleaner. And so the same thing applies as we're taking on our recovery path. Like find a way. And there's a really great book. It's called The Power of Now. And he talks about you can go to a party, and if you had the mentality that you didn't want to go to the party and it was going to be horrible, the party's going to be horrible. But if you had the mindset that the party was going to be great, you get there, oh, it's my favorite song. Oh, these were all the people that I was hoping to meet, right? Like that power of mindset within it, like you get to choose. And so you can choose it as if you were choosing it.
So true. So true.
And then timing. So we've got, well, reflection. So Sherry already mentioned this a little bit with really reviewing it. I had this professor, it was amazing. At the end of every class, he wanted us to write a few sentences on what we learned for the day. And I don't know if you've ever tried to do that. You're like, oh yeah, what did I learn? Right. And that reflection helps you really reflect on it, pull out what was relevant, what was beautiful about it, and helps you bring that back up to the surface. And so it's another layer of that learning, it's another layer of that reinforcing, but there's also this emotional quality behind it too, because you're pulling out what was meaningful to you. And then timing. So we do know that addressing therapy right after the incident or diagnosis is more beneficial, but that is not the only time. And again, that repetition and how often and the frequency and things along that nature. With effort, as we mentioned earlier, as we get older, it does require a little bit more effort. And one of those, not all of it, but one of those is because typically the pathways that have been formed, those are like really thick ropes. And so to rewire a new pathway, it's taken more time where it hasn't had that. And then too, there's other components of chemical and things too.
Yeah, and even though you are, over 30 or 25, right? Because that's when it significantly, well, I would even go back sooner. Most people say puberty is when you do, it slows, and 25, if there's sort of 25, 30 really is another jump. Um, the more plastic your brain is, right, you can affect that regardless of your age. And you can find people who are in their 80s who are very sharp, learning very quickly. And that just comes with the lifestyle and the exercise, the use it or lose it principle from that. So
Yeah.
don't use your age as an excuse that it's going to be too hard for you, because that's just not the case. You can't use it as an excuse anymore.
I tell people that all the time and they look at me, they're like, oh, it's because you're young. And I'm like, no, it's because of science.
Touche.
Right. So diving into that a little bit deeper, right? It is neutral. It is a use it or lose it. And if you are using it and using it frequently, because what fires together wires together. If we've got certain parts lighting up, if they're lighting up at the same time, they're going to help each other. We have another slide. We didn't have it in this time, but yeah, Sherry, your example of the ball and throwing the ball, and there's judging the depth, using your eyes, the being able to catch it. Like there's all these different components of the brain that is lighting up with one simple activity.
Yeah,
And
that's that layering. Sorry, that's
yeah,
that layering part you were talking about on the last slide, right? So to be able to throw a ball and catch a ball requires so many different complex movements, thoughts, processes in your brain, and so many different segments of your brain to work in harmony and symphony together. And rewire, if you've had a stroke or some sort of an injury or MS or Parkinson's, something that's disrupting that flow of information, you that has damaged one of those sections of the brain, you can rebuild that in many cases, right? But it's not going to happen all at once, because you've got to rebuild this segment, then you've got to rebuild this segment, and then you've got to rewire those two segments that work together. And that's why, if you've raised a child, you'll see there are all of a sudden there's this milestone. They weren't walking, they were crawling a little bit, and then all of a sudden, bam, they're walking. It just happens overnight, because they've been slowly pulling together in the background for that skill to develop. And it's not linear at all. In many cases it takes a while, but that know that if you're working on it and you're not getting results, the end result right away, but you're making small, minor changes, it's working. That is what's happening. And so you're wiring it and firing it together to make it happen.
Yep. And this is true not only for movement, but it's also true for emotions. It's true for thoughts. If you're consistently thinking something, if you're consistently feeling a similar emotion, if you're consistently practicing similar movements, that is neuroplasticity. It's functioning across all layers.
Yeah, that's a very important piece for mental health, Izzy, because you get stuck in these loops. That's like depression and
Yeah.
anxiety. That's a loop in your brain, a thought loop, and you're just strengthening it and strengthening it. The more that you focus on it and you're building those neurons. And that's why some of these very interesting new therapies that help you break that loop and cognitive behavioral therapy combined with those new interventions is proving so effective for mental health. It's very exciting what's happening there with neuroplasticity.
Yeah, yeah. Even cognitive behavioral therapy is one of the things I specialize in, and I tell this with people all the time. I'm like, have you ever grabbed a cup of coffee and you're thinking, I'm so tired, and you just keep repeating, I'm so tired over and over? Well, your brain's listening. It's just following commands a lot of times. And so it's like grab the cup of coffee if that's what you drink and sit there with it and go, I'm going to drink this and it's going to give me so much energy, and see and visualize yourself having a great, very productive day. And it's amazing just those little shifts in breaking that pattern can really help us then go about our day in a better way.
Yeah, that's sort of Daniel Amen's theory, right? He's like, the brain is always listening. Be careful what you're
Yes.
telling it.
Yeah, we talk about that a lot in cognitive behavioral therapy. All right. So, what enhances neuroplasticity? And we're also going to talk about what hinders it. Learning with repetition and focus, right? So, we talked about that a little bit. Novelty. So, when you're a kid and you experience that thing for the first time. So, novelty is trying new things. Maybe it's learning a new language or learning how to play chess, creating some type of challenge to build that pathway. And then lifestyle, which we are going to deep dive into next session as well. But exercise, sleep, nutrition are key. And age, like neuroplasticity is higher when we're younger because our brain is still forming until around, debatably, around 25 to 27. And mindset, as we've been talking about as well. And as we cover these lifestyle capacities and sections in this next session, we're going to say it's a little bit different when we look at it from a neuroplastic vision, than just these are the things you need to do, but really looking at how it's going to impact you. And then accelerants, as we said, we're not anti-pharmaceuticals. There are pharmaceutical supplements and psychedelics that work really well as stimulation that's invasive and non-invasive for brain and nerves as well.
Yeah, and that stimulation piece we'll get to quite a bit in interventions. Those stimulate, that's sort of electrical stimulation, and in a lot of cases, that's what that's referring to. And that's just exciting that nerve so
Mhm.
that whatever you're doing is acting, helping it to act faster, which is the same thing as like some of the pharmaceuticals and supplements, and they're finding psychedelics. That's one of the ways in which it's working now. It's just opening it up so that it's accelerated neuron movement, so that whatever activity you're doing is working more effectively. So I think those accelerants are going to play a bigger role in neuroplasticity the more we discover.
Mm.
And so I'm excited to see where the research in that keeps going.
Yeah, yeah. And what hinders neuroplasticity? And in a sense, it's kind of the opposite, but a lack of stimulation, sitting around doing the same thing, not learning anything new, not exposing yourself to anything new, a lack of stimulation. And then chronic stress and negativity. Uh, Most of us don't realize until you've been on the other side of it how much that can play a role, but it blocks neurochemicals like BDNF, which we're going to deep dive into next session, but it's really hindering your brain quite a bit, and it's reducing the amount of neuroplasticity that's available when you're in that chronic stress. And then loss of sensory input can have an impact. So if you have lost your hearing, your smell, or your taste, that can make an impact, as we've already talked those experiences.
Or a sense of touch. That's another one.
That is another one. Isolation and low socialization, which again, Why Your Brain Needs Friends. It does weaken your learning and memory, and it also reduces challenges as well. Toxins. So we'll talk about molds and other toxins that could be impacting. It diminishes that neurological function as well. So these are some of the interventions that we're going to be covering in our next session. We'll cover 3, and then in the following session, we'll cover the other 3. And let's talk about self-advocacy. Sherry, you want to grab this one?
Sure. Yeah. I think in the pyramid, we had this sort of I don't remember if this was almost at the tip of the pyramid, right below interventions, I believe, right? And that's because you need the research component, you need the knowledge component to be able to be an effective self-advocate. But in my opinion, when we were developing that, I'm like, oh, should self-advocacy, the mindset of self-advocacy be that bottom rung there? Because if you don't believe that you are in control of your own destiny, then none of those other tasks are going to be effective, and you won't be able to complete them with any conviction. So I do think this is one of the most important pieces, not only in your recovery process, but in your health. I mean, not just your health, but your life. Sorry. I do think self-advocacy is a big piece of it. And it's back to the farmer model. You're the one who's in charge. You're planning it. This is your life and your health, and it's your journey, and nobody can really communicate what's happening with you inside of you better than no physician can do that. You're the only person who knows that well, and your care team is only responding to what you tell them. Right. So the information you share with them is what they have to react to. And if you don't have the information you need, if you're not articulating what your expectations are, and if you're not communicating that you want to push and try and move forward, then they're gonna react to that. So I like to, a lot of times I think about this in your brain and your life is it's just this blank canvas, right? Sometimes you got a bigger canvas to play with, and you got better paints, you've got better materials than other people in life, but you still have the same canvas and the same basic tools, and it's yours to design and do with what you want to do with it. And your brain, the research now shows that that is completely the case. Your thoughts, your actions, and your belief systems really do affect how your brain functions. And so if you take ownership with that and treat your physician as a partner, not as an authority in your journey, then you will have much better results at getting to the end. And this uh, last bullet here is don't be afraid to ask for help, because there are things you don't know, right? I'm back to the painting example, and I'm going through that right now. I'm trying to learn to do shadows and my watercolor. I cannot get this shot. I'm very much struggling because of the perspective. I can't see it. And so I've decided to go and hire somebody to help me with that, because I just cannot do it on my own. The YouTube videos are not getting me there. I now have to go and ask for some help to get that done. And that's okay, right? We don't all cut our own hair. We don't do, if the electricity breaks or the plumbing, sometimes you call a plumber, sometimes you call the electrician. You call those experts in and you ask for help to get and fill the gaps of knowledge that you don't have. But the next time you do that, now you've got knowledge because you've paid attention to what the plumber or the electrician, and you might be able to troubleshoot some of that on your own. And so that is kind of what I really want to leave you with as part of this series, or this first session in the series, is do not underestimate the value of being your own self advocate, and to take ownership of your journey. It's yours, and nobody else knows it better than you.
And in session 4, we will go over different support groups and things along that nature as well. We have a load of resources within here. And as I mentioned that, also don't forget to go register and gain access to the course portal for those replays and resources. And then on our website, you can also find the Brain Builders Book Club and check out those books. It's for sometimes, right, like even a brain injury. Maybe you don't know that you have one, but you know something is off and something's not working. We've seen this in a few of our case studies that we'll go through. And it might be reading a book to recognize, oh, that's what's wrong. And let me now go down this path of self-advocacy. There's so many resources out there, and we've worked hard to put as much as we can within these 4 sessions. And we hope that it meets your needs. And if it does not, you have questions and there's something that you're still puzzled around, please reach out to us so that we can help support and get you that information. So what we learned today, your brain's not fixed. There are mechanisms of change. You can lose it or lose it. What shapes it? So positive and negative influences, focus, friction, repetition are needed. And then there is the opportunity to regain or retain function, resilience, and a quality of life. Next session will be exploring treatment types. And our Brain Builders Book Club is coming up of why brains need friends. And here's our contact information or my email if you need to reach out with any questions.
All right, Izzy, great job. And don't hesitate to replay the meditation at the beginning of this. If you just need a little quick break, use that when you can. And we look forward to seeing you at our next session.
Great.